I'm your host, Dr. Richard Betts. This program provides information to help you stay healthy, happy, and full of vitality so you can contribute at the highest level to your family, friends, church, and community. I start each show with a disclaimer. It is important that you contact your healthcare provider before implementing anything I may talk about. Hello, I am Dr. Richard Betts, your host for Healthy Living. Today's topic is 5 major reasons to lose weight and tips on what to do next. I'm excited about this information as most people don't realize that they can actually positively change their health and completely heal from many, if not all, of the disease states that they are currently experiencing. Yes, I said completely heal from disease. So let's get started with the 5 major reasons to lose weight. Number 1 on the list, and this is one of the diseases that's very close to number 1 of all the diseases that individuals do contract, and that is heart disease. Now, excess waist fat increases your triglyceride and LDL and VLDL, bad cholesterol levels. It decreases good cholesterol and increases and maintains high blood pressure and damages the walls of the blood vessel system by inflaming the cells that make up the walls. Now, obviously, this is not a good thing. When you have increased bad cholesterol, you have high blood pressure, and you have an enormous amount of inflammation throughout the entire body. This, unfortunately, is a perfect storm for cardiovascular disease. Now, remember, cardiovascular disease can actually culminate into, yes, a heart attack or stroke, and unfortunately, death. My request is that individuals who are listening to this program think about how many friends and or family members have experienced a heart attack, or maybe 2 or 3 heart attacks, or who have had stents put in. This is an indicator of a cardiovascular disease and way too much bad cholesterol. I would also encourage you to think about individuals who have had strokes. How many people in your family or in your friend or coworkers have had strokes? Now, a lot of doctors will say, well, you're just old. And I hate those 3-letter words, old and age, because most of the time doctors think that since you're old, you end up having a potential of stroke. Well, yeah, but you don't have to. You are a culmination of all of the choices that you made up to this point. And if some of those choices include things like carbohydrates on a regular basis, that is a huge potential of you creating a cardiovascular disease and then increasing it to heart attack, stroke, and unfortunately death. Just because you are in your 50s or 60s or 70s, you should not be on medications like atrial fibrillation medications or high blood pressure medications. And unfortunately, when you go on these medications, your doctor tells you what? You're going to have to be on these medications for the rest of your life. This is absolutely 100% not true. Now, the question is that, is it going to take you some time to heal? Well, guess what? You didn't get this way overnight. In fact, you got this way in a longer period of time. I always share with patients that if you are looking to heal your heart or heal your liver or heal your kidneys, from the time that you were diagnosed with the particular disease, I tell patients that it takes about a month for every year to get the body to heal itself with the right nutrition, with the right supplementation, and doing the recommendations that I give to the patient to do they will heal themselves. The next on the list is, unfortunately, the big C word, which is cancer. It is understood that obesity is a precursor to different types of cancer, specifically cancers of the esophagus, breast. And when it comes to breast cancer in overweight people, unfortunately, those ladies who are postmenopausal are at higher risk of developing breast cancer. Endometrium, which is the lining of the uterus. Now, the lining of the uterus, it doesn't really make any difference whether you're an older postmenopausal individual or a younger individual. You still have the possibility of developing this type of cancer. Colon cancer, rectum cancer, kidney, pancreas, thyroid, and gallbladder are all possibilities. There are also other possible cancers that you can develop. This is according to the research of the National Cancer Institute. So, when we have an increased fat, especially around the midsection, this is a possibility of developing these types of cancers. This is well researched, and I would encourage anyone who might be worried about cancer, or there are some of you out there who have battled cancer. Unfortunately, when a person has battled cancer, they have an increased potential of developing cancer. So understand that the reason that the medical profession calls it in remission as opposed to being cured from cancer, and normally what we like to see in the medical profession is that a person be 5 years remission, because once you're in 5-year remission, that was a good remission. Unfortunately, we're seeing an uptick in cancers significantly, and there are some doctors who are saying that there is a high probability that a lot of these cancers that are coming back, and those individuals who have battled cancer, whether it's breast, etc., and the cancer has come back in another system or another organ of the body, they're attributing it to the possibility of the new mRNA vaccines that are producing changes in not only your normal cells, but also cancer cells that might be within the body. And once again, I want everyone to understand that anything that I say on my programs is research. I can back up this information. So there is a lot of studies that have been done and that are being currently done based on the uptick of cancers. And you as an individual might be seeing that there has been in your circle of friends and family an uptick in cancer. And oftentimes what we're seeing also is that the cancers are developing so darn quick. It's amazing at the speed at which cancers are developing. So cancer is a huge issue when it comes to being overweight, obese, or morbidly obese. So this is one of the many reasons that you want to decrease your weight. The new year's coming up, and a lot of people will talk about what they're going to do in the new year. How are they going to change things in the new year? They want to make their lives better in the new year. The number one thing that you can do in the new year is make your body remove fat and get healthier by doing that. Number 3 we're going to talk about is diabetes. How many of you out there who are listening to the program right now all have been diagnosed with diabetes? Now, overweight and obese middle-aged men and women are at higher risk for developing type 2 diabetes, especially when the weight builds in the belly area. And I talked a little bit about that, but we know through research that the more fat in the belly area, the higher risk you are for many of the things that I'm going to be talking about today. As time moves forward, we see more and more children developing this horrible disease as adolescents are packing on the pounds. I mean, think about what you looked like and what your classmates looked at like when you were in high school, okay? And now look at what the individuals who are currently in high school look like. Even individuals who are in sports, cheerleaders, or individuals who are playing basketball, volleyball, they're very heavy, which we never saw that when we were in school. You know, there were a couple of people that were fat or considered obese or morbidly obese, but for the most part, when I was in high school, most of us were pretty thin. Number 4 on the list is, excuse me, had to take a drink, is heartburn. So first of all, the diagnosis is gastroesophageal reflux disease, which is GERD, and that's heartburn, has increased by almost 50% in only 10 years, according to a Norwegian researchers study. It is due to the increase of obesity epidemic. The quote from this study is, increased weight, especially abdominal obesity, increases the pressure over the lower esophageal sphincter, which is the closure mechanism between the stomach and the esophagus. This study explains, and the author, Dr. Inwind Ness Jensen, senior resident in internal medicine and gastroenterology at Levanger Hospital in Norway, he states the pressure forces the sphincter to open more frequently and for longer durations, promoting reflux of acid content from the stomach to the esophagus. So this is really important because I can't tell you how many patients and family members or friends I have on antacids. Now let me talk about antacids really quickly. A lot of antacids contain aluminum in it. Okay, first of all, aluminum, there is nothing in your body that requires aluminum. You never have a deficiency of aluminum, period. There should never ever be any ingestion of aluminum. But most of the antacids out there contain aluminum. That is completely crazy, in my opinion, because aluminum is a heavy metal and should never be in the body. Unfortunately, a lot of the heavy metals are metals that have an affinity to brain matter. And we know through research that the portion of the brain that the heavy metals oftentimes get to are those cognitive portions of the brain. And we also know that a lot of the dementias, whether it's Alzheimer's, Parkinson's, or ALS, have patients who have an enormous amount of heavy metals in those particular brain matter. So it's important to understand what you are putting in your mouth, especially when it comes to over-the-counter medications. And we have an epidemic, I would consider it a pandemic, because when there are so many people taking these antacids on a regular basis, this is a telling probability that these individuals are consuming foods that they shouldn't be eating, and their body is not getting the nutrition that it requires in order to maintain health. So it's important to read ingredients. I know a lot of people say, well, wait a second, if the government has allowed this to be on the shelf, then it should be safe for me to take, right? The answer to that question is absolutely 100% no. Buyer beware. I know in the past I have talked about your personal advocacy. when it comes to healthcare, you are your best advocate. Your doctor is not your best advocate. Your partner will probably be a pretty good advocate. But when it comes to health advocacy, you have to learn. You have to teach yourself on all of the things that are happening in your health so that you maintain your health. Excuse me. So the number 5 in this list that I'm going to talk about is immunity and influenza. Okay, so we're in the wintertime now, and one of the things that people get during the wintertime is the flu, okay? Those individuals who are carrying extra weight, who are obese or morbidly obese, their immune system is very, very poor. Now, the number of deaths from flu and cold are in line with the rate of people becoming obese. Recent research from the University of North Carolina at Chapel Hill shows that obesity is associated with an impaired immune response to the influenza vaccination. Let me read that again. Impaired immune response to the influenza vaccination. So, what that is telling us is that those individuals who are actually taking the vaccine, the flu shot, it's not helping. It's not helping, especially those who have increased weight or overweight or obese. The research shows it's not helping. Now, interestingly, the yearly flu vaccine is rarely above 20% effective. So wait a second. You're telling me that the flu vaccine only is effective maybe 20% of the time? No, I'm saying it's less than 20% of the time. It's crazy. Yet we're told every year, get a flu vaccine, get a flu vaccine, get a flu vaccine. I'm here to tell you that your immune system, if it's working like it should be, it's going to be much better than anything man-made that you stick into your body. The flu vaccine does not help your immune system like we've been made to believe. In fact, during the last 3 years, we've been led to believe that the only thing that is going to help keep us alive is taking a vaccine. Most doctors, unfortunately, have forgotten about their understanding of the body's innate immune system and the awesome power it has. If you give your body the right building blocks in the right environment, it will kill off any parasite, bacteria, or virus it comes in contact with. This is 100% true. It's been happening for eons. Since the existence of human beings, we've had an immune system that seeks out invaders, and once it gets those invaders, it destroys them. And it's amazing at how it destroys them. I would encourage anyone to go on the internet and Google white blood cells killing bacteria, or white blood cells killing cancer cells, or white blood cells killing parasites. And the interesting thing is that in the last 20 to 30 years with electron microscopes, we can actually see how our innate, amazing white blood cells kill these things. And unfortunately, we have forgotten that for whatever reason in the medical profession. We have forgotten our body is an innate, amazing healing mechanism and body. It's just beyond my comprehension of why we think that a drug, surgery, or radiation is going to help us stay healthy. And in fact, most of these things don't get you healthy. They just stop you from downward spiraling into major disease and eventually death. Now, I know that today's program was just 5 things. I'm going to touch momentarily on a few more things that I think are extremely important. The next one I'd like to talk about is depression. Now, interestingly, obesity in women is linked to a 37% increase in major depression. And the two conditions often trigger and influence each other. Heavy women also have more frequent thoughts of suicide, according to the American Psychological Association. Now, we're coming up to the Christmas, and oftentimes I have noticed that patients who are obese oftentimes get more depressed at this time because maybe their kids are out of the house and they're not able to get home for Christmas, or they recently lost a family member or a spouse, and they spiral downwards. Now remember, I have talked in the past about the sugar issue. Well, sugar also increases the potential of depression, but it also increases the fat, and it decreases your immune system's ability to fight off diseases. And I have shared in the past that this particular time of year is the sugar time of year. It started at Halloween and won't end until Mother's Day. This is when we consume the most sugar that we do throughout the entire year. One of the other things that I like to talk about that I'm finding in my personal practice, and a lot of my other colleagues are finding as well, is infertility, gestational diabetes, and birth defects. So wait a second, you're saying that if I'm obese, I get pregnant, I have a higher potential of having my baby have birth defects? The answer is yes. Also, understand that the more weight that you are carrying, it is an indicator of how deficient nutrients that you have for that baby to start growing in utero. So what happens is that when the fetus finds that it's not going to have the nutrients that it needs in the first 3 months of gestation, it's going to abort itself. And so I'm finding that women who are heavier and are obese or morbidly obese are having trouble keeping or even getting pregnant. Because remember, in order to even get pregnant, you have to have certain nutrients to prepare the uterus for the implantation. And if that doesn't happen, then you can get an embryo to come down the fallopian tube and get into the uterus, but if the wall is not prepared for the implantation, there is not going to be a baby. So it's important to understand that heavy women experience more miscarriages and pregnancy complications, such as the gestational diabetes and preeclampsia, and are more likely to give birth to babies with birth defects, unfortunately. In addition, obesity can lower the success rate of in vitro fertilization. So if you're looking at going the route of IVF, you have the potential of pregnancy. They usually do 3. And if you are obese or morbidly obese or carrying more weight than you should, that's an indication, once again, that you have a decrease in nutrition. And basically what you're doing is you're probably eating what I call crapohydrates. It's all of the stuff in the box, can, and bag foods in the center of the grocery store, and you are depleting your nutrients because all of that stuff usually has sprayed on nutrients that is not, or I should say it's not for human consumption, or I should say it should be not for human consumption, because some of the stuff on those labels is just ludicrous at what we're putting in our body. Now, a man's fertility suffers too. Obesity is associated with low sperm motility and altered testosterone levels, as well as low sperm count. So you need billions of sperm in order to get one to the egg. Remember, the sperm goes through the cervix into the uterus and then has to swim through the uterus up into the fallopian tubes. And that's where the egg is inseminated, is in the fallopian tube. Well, if you don't have enough sperm and they're not healthy enough, instead of swimming in circles, they don't swim straight, they're not going to get to the egg in the fallopian tubes and not be able to inseminate the egg. Interestingly, if a man's testosterone is low, and that we know through research can happen through the man being obese, then he's not going to produce enough sperm in order to get the individual pregnant. So, I'm going to start talking about tips on what to do next. So, number one, this is really one of the most important things that you have to understand is first decide whether you are happy being fat and sick, or you want to get help to heal yourself from being fat. Most people have tried weight loss program after weight loss program only to go back to the weight they were at or even increase to a higher weight. Doing something over and over again, expecting a different result, is defined as, guess what? Insanity. Seek out someone who can guide you on losing weight and get you back to a more healthy, happy you. Stop eating all of the carbohydrates that are boxed, canned, or bagged in the grocery store. This alone, you will lose anywhere between 5 to 15 pounds or more just by not buying poison chemicals and antibiotic-laden carbohydrates. Cheerios is not heart healthy, period. No matter how much Cheerios company says it is not. The next one I would recommend is drink water. I always tell my patients water, water, water. And when they ask, well, what do I need to do? Water, water, water. Well, what do I need to do? Water, water, water. If you are a pop drinker, stop it immediately. I would encourage you to read the ingredients to these products. The purpose of everything in them is to create addiction. And most of you who are drinking pop know you are addicted to pop. It's just like smokers. Smokers are addicted to the chemicals that are in the cigarettes. This addiction also creates disease throughout your body. It's amazing how people in general do not recognize that what they eat could be actually creating a disease. In fact, most doctors don't even ask what you are eating and help guide you to eating better. Well, the question is, why don't they do this? Because they don't know. In fact, if you take a look at your own doctor, most likely that doctor is overweight, obese, or morbidly obese. So you're taking recommendations from a person who is overweight, obese, and morbidly obese? Does that make any sense? The next thing I would encourage you to do is increase plant fiber in your diet. Most people who are overweight or obese don't have regular bowel movements. Okay, folks, you have to poop on a daily basis. They are literally full of poop. By increasing plant fiber, the bowel will clean itself out naturally. This alone will decrease weight by 5 to 10 pounds. When you increase plant fiber, you decrease the need to constantly eat. Remember, most of the food that fat people are eating right now has no nutritional value and is very addictive. The last thing I'm going to recommend is stop consuming sugar. I know it's hard, especially during this time of season. You know, you have the Christmas cookies, and you have the gingerbread houses, and you have, Grandma Bessie's great, what do they call, marshmallow treats. Yes, I understand that. But just by doing this, you will decrease your weight by 5 to 10 pounds. So just the few things that I recommended, you could lose anywhere between 10 to 25 or 30 pounds. Now, the last thing I would recommend is to seek out a functional medicine doctor and get an appointment to go over your current illnesses and discuss scientifically proven ways to lose weight and get healthier. It must be a functional medicine doctor, as these doctors are trained in disease states, nutrition, natural supplements, and foods that heal the body. I am currently accepting patients as I am a functional medicine doctor. If you are interested in scheduling an appointment, I am currently taking patients for the beginning of the year. Call 563-241-8760 to make that New Year appointment to help you get healthier, happier, and smaller, along with getting rid of many of your current health challenges. I would like to leave you with one final thought. Remember, you are the only person who cares about you. Although you have a doctor, she spends 5 to 15 minutes with you once a year. They have many others like you, so their focus is getting you in and out. It is up to you to educate yourself about health and the steps needed in order to create your optimal health. If you are waiting for a doctor to make you well, you will never be well. They will give you a drug to stop the downward spiral into death, but they are not there to help you get healthy. Just remember, unfortunately, I have run out of time. But if you are interested in becoming a patient of mine, call 563-241-8760 and make an appointment. Until next time, continue to strive for healthy living.
You're listening to AM 1340 KROS, Clinton, Iowa.
FM 105.9.